went to your doctor with your lower back pain. They sent you MRI and told you you got a disc herniation or you got a degeneration and that you might need surgery. Now, at the moment, people do exactly what they're told because why would you question your doctor? So you go home, you start researching spinal surgery. So you tell your families about it and then the fear set in. Now, I want you to hear this before we go any further. Most disc herniations don't need surgery. The research support this. The outcomes support this. And the hundreds of clients I personally work with support this as well. Now, I want to be super clear about this. This is not medical advice. I'm not a doctor. I only got my master's degrees in biomechanics and kinesiology. What I'm sharing in these videos comes entirely from my experience working with 500 plus clients with this herniation over the past 6 years. Now, my goal today is not to tell you what to do. It's to make sure you have the full pictures with the right information before you make one of the most important decisions of your life. Because once you're done the surgery, there's no going back. Most people who got this diagnosis have no idea what a disc herniation actually is. And the language doctor used to make this sound far more devastating than it is. Your spine is made of vertebrae that stack on top of each other. Now, between each vertebrae, we have a disc. Now, think of it like a jelly donut. Now, the disc acts as a shock absorber. So it absorbs the load between each vertebrae. Now, it allows your spine to move and flex without bone grinding on each other. And this herniation happens when the soft inner core pushes through the outer layer. Now, like squeezing a jelly donut and then feelings start to come on one side. Now, that sounds pretty devastating. And when you see this on your MRI, it looks pretty devastating too. But here is what your doctor may not have told you. Almost everybody has this herniation to some degrees, but not everybody has pain. A study published in New England Journal of Medicine scanned the spine of people with zero lower back pain. There's no symptom, no history of injuries. They're living completely normal. Again, pain-free. And around 64% of them has this abnormality visible on the imagings. They have bulging discs, they have herniations, they have degenerations, all show up on their MRI. And those people feel completely fine. Now, let that thinking for a moment. So the real question is, if so many people walk around with this herniation and feel nothing, what is yours causing you so much pain? And that question is the whole video's all about. And the answer is not what most people think. This herniation on your MRI is not automatically the source of your pain. All right, I'll say this one more time. That this herniation on your MRI is not the source. It's not automatically the source of your pain. Imaging shows the structure. It doesn't show why your nervous system is reacting the way it is. It doesn't really show what movement pattern look like. It doesn't really show what muscle has stopped working. Or is there any other underlying reason the disc got loaded unevenly in the first place? And that right there is everything. Just look at your MRI result alone and assume that the herniation or the degeneration or the bulging disc is the source of your pain. It's like you have a one flat tire on your car and you assume that one flat tire is the entire problem while your car is completely out of alignment. Now, sure, your MRI shows the damage, but that is already done. We can't really change that. The more important information is why you have this one flat tire in the first place. So this herniation itself is really the full story. What is driving your pain is what your nervous system is doing around it. And to understand that, you need to understand the 4 layers that are keeping you stuck. That's what I told all my one-on-one clients as well. Layer number 1 will be your structural layer. At some point, your body start loading a little bit differently, asymmetrically to protect the painful area. Now, in this case, maybe your lower back, maybe one side of your pelvis, maybe your hip flexors. Now, over time, you're slowly developing all those imbalances throughout your body. Maybe one hip is carrying more load than the other. Maybe you walk a little bit differently. Maybe your pelvis tips forward or backward or laterally. The wrong muscle overworked, while the other muscle has completely shut down. Now, everybody's a little bit different, but all you were trying to do here was protecting the painful area, which will be your lower back. And that asymmetrical loading pattern put uneven pressure on that disc every single day unconsciously over months, over years, until your disc couldn't really handle it anymore. Now, this can be your herniation, it can be your sciatic pain, it can be your bulging disc, degenerations, etc. Everybody just hurt a little bit differently because how your body compensates. Now, after this will be your layer 2, your nervous system protection. Now, the movement pain show up once your body senses this constant pain. Your body, your brain, and your nervous system will launch a protection program, basically to go guard the muscle around this even more, which create more movement compensation and more imbalance. Now, one more layer after that will be your balance system compensation. Right now, your body has to completely recalibrate how your body moves around this pain. Nervous system change, how your body move change, imbalance change. Also, it change how you distribute your weight every single step. And it's a constant loop reinforcing the same loading pattern that damage your disc in the first place. Now, there's one more layer, that's your vision system. Now, your eyes feed roughly 90% of the information to your nervous system for them to use to assess threat in your body. Now, when your vision system is compensating and when you're not moving correctly, when you have to recalibrate how your body moves, when you have all those imbalance, all those pain in your body, your vision system has to compensate as well. And if you constantly feed the wrong information to your nervous system, well, guess what? You just keep feeding your brain, your nervous system, wrong information, more threat signal to a body that is pretty overloaded already. So all four layers feeding each other every single day, unconsciously. And here is what it got more important. Now, I want to be strict with you as well. A lot of people do recover from this herniation or degeneration, and this is where chiropractic, massage, physical therapies comes in. Now, there's nothing wrong with those approach. They're gonna provide relief. They help you manage the pain while your body heals. And for some people, that is good enough. I'm absolutely happy for you. I had this pain for 15 years. I don't want anybody to drag this any longer. But here's the problem. A lot of people manage their pain. They rest more. They do some generic exercise. They go to their appointment and then the herniation normalize on the imaging, but they still have this stubborn pain. They still have restriction. They can't really figure out what to do. They can't play golf. They can't play with their kid. They can't even sit longer than 40 minutes. Now, here's why. Managing your pain doesn't really give your body to heal. For a lot of people, if you're still loading the disc unevenly every single day, if your nervous system is still running that protection program, if your movement pattern are still compensate, you still have all those imbalances throughout your body, there's only a matter of time the pain will come back. And you can't rush your way out of a structural imbalance. You can't massage your way out of a nervous system protection program. And you can't adjust your way out of a compensated movement pattern. You have to actively training, actively repattern how your body moves. Your disc needs space to heal. Your nervous system needs to come out of the protection program so your muscle can stop compressing the disc. And your movement pattern need to be repatterned and retrained so you can stop loading the same spot every single day. And you have to give your back a reason to heal in the first place. Not just rest more, try to manage the pain and hope for the best. Hope, for me, is not a strategy. You have to address all those four layers we just mentioned in the right sequence. I have videos about this where I break it down everything, so you can check the videos after this one, link down below. Now, some disc herniation do need surgery. This is not an anti-surgery video. There's specific situation where you should now wait. If you're experiencing sudden loss of bladder, stop watching this video, go to hospital right away. But if you're being recommended surgery just based on the imaging and your pain level alone without severe neurological loss, you can pause for a second. View all your options. Surgeries remove the herniation, but it doesn't really fix the structural imbalance, the movement pattern that load that disc unevenly every single day in the first place. It doesn't really reset your nervous system to reset the protection program. It doesn't really repattern how your body moves on a daily basis. I have so many clients who had a surgery, feel good for a couple months, and then find themselves back in pain in just next 6 months. The disc might be gone, but the system that created the disc problem in the first place is still running in the background. I've helped multiple clients to move to train without their lower back pain and help a lot of them avoid lower back surgery and hip replacement as well. I almost done the surgery to my own body, but I paused and I see all my options. Now I'm completely pain-free without a surgery and I can do whatever I want. Now, if this video gives you a different perspective on your back pain, drop in the comment and tell me where you're at right now, what you were told, and how long you have been dealing with it. I read every single comment. If you have not already, make sure to subscribe. And if you want to understand the all four layers that's driving your pain and you want a proper plan built specifically around your body, you can watch the videos linked down below. Alright guys, hope you guys enjoyed this video and I'll see you guys next time.